Excellencies, distinguished guests, dear colleagues, good morning. It is a pleasure to be here today addressing you on behalf of FOUR PAWS. A little over 5 years ago, I was still working in an international NGO responding to the needs of children and families in conflict zones, wars, and disasters. If at that time someone had told me that an animal welfare organization would take the stage at the World Health Summit, I would have asked why. I would not have seen the reasons or understood the urgency. But today, after 5 years working side by side with my amazing colleagues at FOUR PAWS and our partners, and after witnessing how the COVID-19 pandemic showed us just how existential protecting animals has become for human health, there is no place I would rather be. Because it is undeniable, animal welfare and an ecocentric approach to health, where we rethink how we treat animals and the environment, can help us overcome the greatest health crisis of our time. For our generation, for our children's generation, for animals, and for the planet we share. We are at crossroads. The way we treat animals, the way we change land use patterns, and the resulting impact on our environment have all left deep marks on human health. And the scale of the problem is significant. More than 70% of emerging infectious disease originate in animals. 6 out of 7 WHO declarations of public health emergency of international concern have been zoonoses, diseases of animal origin. And 73%, yes, 73% of antimicrobials are used in farm animals, driving antimicrobial resistance, one of the greatest threats to our shared future. This last point keeps coming back to me, especially when I look at my 3-year-old daughter and wonder what kind of healthy future can she have in the face of this reality. All these statistics are not isolated numbers. They are symptoms of a deeper problem, an unbalanced and sustainable relationship between humans, animals, and nature. With the adoption of the pandemic agreement, we have witnessed the beginning of a paradigm shift. Health strategies can no longer stop at treating symptoms. Human health can no longer be considered in isolation without addressing what we are doing to animals and to the environment. Governments have now recognized that to prevent future pandemics, we must address the root causes of outbreaks. Protecting animals and their habitats is not optional, it is essential. The old siloed approach, treating only human health outcomes, will not carry us through the next crisis. One Health offers a pathway, acknowledging the interdependence of human, animal, and environmental health. And the truth is, we don't need another flashy concept or brand new framework. The solution is already in our hands. We simply need to shift from reactive crisis management to proactive prevention by addressing the root causes of health threats at the human-animal-environment interface, together and across borders. That means working across ministries and government departments, engaging across different levels of society, building on science to policy approaches, and fully integrating animal welfare and environmental protection into health strategies. If we do this, we can mitigate the risk of disease outbreaks before they happen, before humans suffer, before economies are disrupted, before trust in global cooperation is weakened. Improving animal welfare is not just an act of compassion. It is a central component of operationalizing the One Health approach. Protecting animals and their habitats is protecting human health and safeguarding the well-being of future generations. The challenges we face are immense, but they are not abstract. They are about the food we eat, the medicines we rely on, the air we breathe, and the bonds of trust we build between humans and the natural world. We often speak about future generations. I have referred to them a couple of times. But the truth is, those generations are already here. They are sitting at our kitchen tables, walking to school, and dreaming about what they might become. When I look at my daughter, I'm reminded that the choices we make in conference halls like this one will echo in her life and in the lives of countless children around the world. That is why conversations like these matter, not in theory, but in practice, in policy, and in the everyday decisions of governments and societies. We have a long road ahead, but it is also inspiring to see many governments, experts, and institutions that have already embarked on this journey. And today we will hear more from them. So let us use this moment to build bridges, to share experiences, and to remind ourselves, while many animals have no choice, we do. Thank you very much, and now let me hand over to our co-host, PREZODE, Marisa Peyer. Thank you.
Dear Excellencies, distinguished guests, colleagues and friends, it is a great pleasure and honor for me to welcome you to this important event, co-hosted with our strong partners FOUR PAWS, the German Federal Ministry of Health, and the German Interministerial Network for One Health. PREZODE is an international coalition of more than 260 members, including government, research, academic institutions, technical experts, private sector, NGOs, and civil society organizations. We are all united to promote a paradigm shift from response to prevention through a bottom-up and a truly One Health approach. I've learned a lot in yesterday's keynote sessions during the first day of the World Health Summit. We've learned that prevention within the healthcare system faces many of the same challenges as prevention in the pandemic threats arena. We must demonstrate that prevention strengthens existing health systems, co-benefiting them beyond only pandemic preparedness, and that it is smart investment in resilience. We also heard that activism to gain public support and push prevention higher on the political agenda was very much needed. And co-creation, and Africa said they were ready and already implementing it, has emerged as a key innovative approach to make this possible. We have also learned and heard about the importance of building coalitions to raise awareness and support a strong technical prevention agenda at the highest political level. Together, we are stronger. And this is an example on how leadership and advocacy can drive changes. So since COVID-19, there is a broad recognition that prevention and cross-sectoral collaborations are essential. Everybody agrees. Yet, investment in prevention remains limited, precisely because success of prevention is invisible. When nothing happens, that's how prevention works. It's harder to value and to fund. The bottom-up approach that we are all pushing together embraces this invisibility one step further, because if local communities can reduce risks and contain potential threats at their level and early, the world may never know about them. And that is the best outcome we can hope for, but it needs to be supported. And One Health brings another layer of complexity on top of that, because coordination, shared responsibility, and shared budget is very difficult to implement, but it's also a great opportunity. Especially under the current constrained resources, we must act smarter, build synergies, and ensure greater impact for every effort. The ongoing pandemic agreement offers a unique chance to embed prevention and One Health into a concrete national actions, and PREZODE and its partners stands ready to support countries in this transformation. So today's discussion is a step toward shaping that support and advancing a new model of global health governance, one that goes beyond symptom control toward prevention and resilience. And I wish you all a very fruitful discussion. Thank you very much.
Well, thank you to the two presenters from the co-hosts. I'm Helen Clark and I'm your moderator for this session, representing the ongoing independent panel for Pandemic Preparedness and Response, which I have been co-chairing for some years now with President Ellen Johnson Sirleaf of Liberia. Thank you all for being here. Someone made the comment it's as popular as a Taylor Swift concert. And I'll call you all Swifties because you were swift enough to get in the door and others could not. But the great news about that is that the pandemic issues are still grabbing attention at meetings like this. One of the greatest fears I think many of us had as we began the process of inquiries and recommendations about what to do to stop something like COVID-19 ever happening again was that we'd get so far into the cycle of panic and neglect that people would give up on the issues. Not so. We're seeing a lot of attention given to these issues at World Health Assembly, UN General Assembly just last month, and then, of course, here at the World Health Summit. So terrific to see you all. Now, just a reminder that the May 2021 report of the independent panel was titled, COVID-19, Make It the Last Pandemic. We'll never make it the last pandemic unless we grapple with the issues we're grappling with here today. And on the spectrum, we have prevention, we have preparedness, and I've been to a very good session around that yesterday with national health agencies preventing. And then, of course, there's response if the worst happens and how you mobilise money for that. But isn't prevention always better than cure? I think we all operate on that assumption. Obviously, the negotiation of the core text of the pandemic agreement has been a tremendous fillip to everyone who cares about these issues. The next phase, as this very well-informed audience knows, is to negotiate the PABS annex, and the issues in that have been vexatious from the very beginning of the negotiations. But let us hope that the next step can be taken May next year at the World Health Assembly, because we can't even start implementing the agreement until we have the PABS annex, and then you need to get the 60 ratifications and so on. But actually, there is so much that can be done before the end of that formal process. And I think these are some of the issues we want to address today. How do we work to prevent pathogens jumping from animals to humans? How do we address, as the speakers before me have said, some of the drivers of the outbreaks linked to what we as human beings do as we drive biodiversity loss, the way we farm, what's happening with our climate and so on. And if we're going to wrestle with these issues, we must vest ourselves fully in the One Health approach. The pandemic agreement, I think, gives these very important areas renewed focus and urgency. And the critical questions before us today is, what will this approach, this One Health approach, mean in practice for countries and regions? What new ways of working are needed within our countries and at the multilateral level? How are we going to finance these new approaches as we tackle this global public good challenge? So we've got great panels to take us into these issues, and right on cue, around 11:15, I invite panel one are going to come to the stage. Apologies to all who we have our backs turned to at any particular time in the fishbowl, but let us invite to come forward now our panel one, and you all know who you are, and I will call you in as we get to the questions you're coming prepared to answer. Thank you. To introduce. Oh, I do. Right. Now, Dr. Christian Drosten, a virologist, scientific director of Global Health and director, Institute of Virology, Charité Berlin. What does beyond symptom control mean concretely, and how should policymakers approach this concept in practice?
Yeah, good morning, and thank you for having me here. So I'm an academic researcher, and I've been involved in research that early on was called virology, virus diversity, and then it turned emerging viruses, then it turned zoonotic diseases. Now it's termed One Health, and it's still research. And this is actually the elephant in the room. that we are speaking research almost 70% in this community of One Health and, let's say, pandemic preparedness, all the terms that you already mentioned, without acknowledging that research is in the $1 million scale, while surveillance and control of a pandemic, or let's say livestock surveillance, captive wildlife disease surveillance, is in the billions. And the thing that worries me more and more is that we are seeing showcase research, to express it in a positive way, being used as a decoy or an excuse in the political sphere to not really turn the attention to the heavy investments that it will cost to really prevent something by surveillance and by control programs, which is completely different from showcase research cases. Yeah. So we will also in public health not say that we will protect the population, because we are already doing so many interesting research studies here and there in epidemiology. Yeah? So we are understanding how to better model the spread of disease agents, or how to, I don't know, to disinfect sources for nutrition or water in the lab, yeah, without caring for water sanitation, without caring for disease notification, for vaccination programs. Because we're all doing this nice type of research, and it's all published in journals. Yeah, so, and that's my biggest concern currently. So I would be better off actually advertising as a researcher for more research in this field, but I won't, because I'm maybe a bit too idealistic about these things. I would say let's continue a nice type of research, but let's understand that what we are doing is a type of basic research, right? So, like, there was a statement paper recently in one of the big microbiological journals saying, well, what does all of this disease reservoir research yield? Has it ever prevented a pandemic? And then there comes a table that says all of these diseases and how research has not actually got the point early enough. And this is like, what does it bring if all of these groups somehow study a pathogen and find a disease, a metabolic trait of this pathogen that we can use as a drug target? Has ever one of these 100 groups that we are analyzing here brought a new drug to the market? No, certainly not. But we need a whole research community. This has to be active. This community has to come up with solutions or suggestions for solutions, but this does not mean they are bringing up applications. And this also does not mean the research investment will pay for the next application. Yeah? So the financial scale is just a different scale. So we need both. We need the research. We shouldn't expect solutions from every type of research endeavor. We need a research community, and every hundreds or 200s group will be successful. But then above that, we already know what to do. We already know where to invest, which is mainly in livestock and captive wildlife disease surveillance and control.
Sobering, yes. Well, while we process that, we will go to Professor Wanda Makota from the other end of the hemispheres, University of Pretoria, One Health High-Level Expert Panel Co-Chair, Director, Centre for Viral Zoonoses, Faculty of Health, University of Pretoria.
Those people who don't know.
It's on. Yep.
Yeah. Okay, great. Thanks. It's really great to be here. And although I'm a virologist, also by training, working on similar viruses than Christian, I'm going to speak from a completely different perspective now, and really what needs to happen on a high level from the One Health high-level expert perspective also. For those of you who don't know what OLAP is, OLAP was established in 2021 as after a call from the French and the German government that there should be a panel advising what we now call the quadripartite, so it's WHO, WA, FAO and UNEP, simultaneously on One Health issues and how they can address some of these issues together. That immediately tells you it's not an easy task. I think it's one of the only panels that needs to advise 4 UN organizations together. So the first term of OLAP that started in 2021, there was a lot of outputs, really laying the foundation. Things like the definition, we published a paper on what prevention of spillover means. But then we moved into the second term, and we had to have a focus on implementation. And this is where it actually became really complicated. It was easy writing, not easy, but it was easier writing these high-level documents, writing One Health, joint plans of action. But then getting to implementation is really, really difficult. And I think that's also why we have the conversation today. Governance, extremely important, not just on this global UN level, but also translating back to countries, regions, and districts, all down to the ground. If those structures are not there, I always say the devil's in the detail, things don't work. It's nice to talk about things, but then when you get to the ground, it becomes very difficult. So some of the things that OLAP has been doing, and we're actually still alive and kicking, although we've been a bit quiet, there's a lot of things going on in the background, is really putting a document together currently for the quadripartite to tell them, to advise them, not to tell them, to advise them how to do things, how to leverage things that they can do together. We must remember that these organizations have certain mandates, but there's some ground where they can work together. Some of it is around policy and governance, capacity building. How do we navigate the funding environment so that we're not duplicating resources? How do we look at data sharing? That's one of the other things that we're looking at. Equity and diversity, leveraging indigenous knowledge across this space for One Health, really important. So this is some of the things that we're putting together in a document. We're still scientists, so we look at it from a perspective of what is available also in the scientific literature, what's going on in the quadripartite, and how can we make recommendations to do some of these things together. It became a very complicated landscape in the middle of all of these exercises because of the changes in geopolitics, changes in funding, resource restrictions, both HR, operational, several levels. So you sometimes have to also rethink if things needs to be done the way that we decided it had to be implemented 2 years ago by writing a One Health joint plan of action between the organizations. So all those discussions are currently going on within the UN to try and optimize how we go forward with some of these One Health things. Then the other thing that's really interesting, and I see Jean-Luca, one of the OLAP members, is there at the back, and he's really responsible for looking at this, and this is part of today's discussion, is governance. So we realize that we actually need to look at what is available in the quadripartite systems in terms of governance. Now, this can be binding treaties, it can be more agreements, and Jean-Luca will be able to explain that much better as a lawyer. I'm a virologist. But we're mapping that environment to see what can we leverage, because that will translate back into member states and how they will look at things when they have to implement things in countries. So we're currently just doing it on a global UN level, but it's also important that that translates into a regional and international level and how we can apply that in the future. So I'll end there. Thank you.
Well, that really segues quite nicely, I think, to Nina Jamal, who's Senior Head of Global Affairs at 4 PAWS. Because, Nina, the question to you is, do you think currently the ideas around One Health and what needs to be done are sufficiently anchored and enabled in our international agreements and governance and national practice? What more do we need to do?
So I'll divide my answer into 2 bits. One of them is what we have right now, and the other part is what's missing, or our collective homework. What we have is multilateral environmental agreements tackling climate change, biodiversity. We have the pandemic agreement as well. With the pandemic agreement, we managed to see a lot of essentials. One Health is an legally binding instrument for the first time. We have a focus on developing national strategies together with communities to address emerging infectious diseases, prevent spillover at source, in a whole of government, whole of society approach, interministerial coordination, together with intergovernmental organizations, getting the support that governments need. So these are essentials, learning best practices as well. What we also have is a lot of national, regional, international examples we've seen with OLAP, the One Health Joint Plan of Action, with the quadripartite, regional collaboration across borders, because viruses don't know borders. And on national level, there are quite a few examples from our colleagues from PREZODE, so through the projects that they've done. So in Africa, we have youth-led One Health groups in Cameroon. In Gabon, there were 3,000 people trained for sustainable wildlife management. In Madagascar, there's a mapping across the human-animal environment interface, tracking pathogens early on so that we have early interventions. So there's a lot here, but our collective homework is tied to the next step. And the next step is not just prevention beyond symptom control, it's prevention beyond early detection. So what we need to see here is the tackling of the root causes of disease outbreaks. So, for example, factory farming. Factory farming, wildlife trade, fur farming do not only cause immense animal suffering, they're also the spaces where diseases are spread. And they're not sufficiently part of the multilateral process. Multilateral agreements do not tackle factory farming. The environment tracks focus a lot on the energy sector, but not enough on the food systems and their contribution to disease spread. So one element for our collective homework is tackling the root causes. The other element is resources. This is a big gap. Governments are going to need support, and prevention is going to cost a fraction of response. So this is a very important investment that we need to focus on. And the third part is collaboration. Collaboration on international, regional, and national level. So on the international level, we need to see stronger collaboration across the quadripartite institutions. We need to see more building of synergies across multilateral agreements, because they're also all working in silos. They all cover bits and pieces of the pathway, but nobody's looking at the gaps. So they need to work together to figure out what they're doing and where are the gaps. And collaboration on regional level or interregional level, because we have regions that have a lot of experience in tackling zoonotic disease outbreaks, and we have regions with resources. So if they work together, if they partner, there's a benefit for both sides. And I guess I'll stop here, and looking forward to hearing.
Well, you mentioned the magic word resources. And the last one to come in is Mikhail Garnier, the Deputy Head of the Pandemic Fund. Mikhail, on top of the chronic underfunding of your fund, we're now faced, of course, with the acute financing crisis across global health and development generally. So how do we ensure that a One Health approach can be pursued and accelerated, and how do you see the fund relating to this?
Thank you, Helen. And I need to start by saying that we always said that the Pandemic Fund is a child of the G20, but it's a baby of the IPPR, and it's one of your babies around the world, and I want to thank you for that. But back to your question. In fact, the global health system is undergoing two major shifts. The first one is a challenge to translating the One Health approach into concrete actions and collaboration across sectors. It's not always easy to come from papers to concrete action, and we face this again. This is not a new challenge. It's well-known and long-standing. But we are finally seeing progress. And one example is the work done with the project funded by the Pandemic Fund. So I will bring a kind of optimism touch. The second is, of course, the financial one. And the funding has always been an issue, but today we're seeing seeing something different by its magnitude. This is not just the continuation of past trend, it's really a new level of pressure. It's also an opportunity for change in our decisions, easy to say, huh? But we'll try to make it happen. But from where I stand at the Pandemic Fund, I can say that progress is happening. When countries are incentivized to act, they do. In less than 3 years, we have supported already 47 projects across 75 countries, LMICs, low and middle income countries, for $7 billion portfolio. These projects have led to real investment in strengthening capacities in surveillance, laboratories, and workforce, with always the One Health approach, because our work is based on the One Health approach, defined by all you mentioned before, and especially through the definition of the OLEP. And we work with the cooperation of our 14 implementing entities, multilateral development bank like the World Bank, the Inter-American Development Bank, the Asian Development Bank, and so on. 3 UN agencies, WHO, and I want to thank the work done by Stella and her team, UNICEF and FAO, and 3 global health initiatives, CEPI, Gavi, and the Global Fund to fight AIDS, tuberculosis, and malaria. Let me give you a few examples. You mentioned governance. Governance is key. And in our project, we have been seeing some establishment of clear coordination mechanism. We support them, of course, in Bhutan, India, Indonesia, Myanmar, South Africa, and Zambia. Those are progress in action. It should be everywhere, it's coming, but I wanted to quote those one. Multi-sectorial early warning system and collaborative surveillance platform are now in place in Bangladesh, Bhutan, Cambodia, Indonesia, Moldova, and Sierra Leone. And multiple trainings with thousands of people are in place, occurred for health workers, but also for veterinarians, community-based practitioners, and cross-sectors actors. It's not always perfect. There are roadblocks, clearly. But for us, it's only the beginning. And it's a result of clear incentives, strong political support, and effective coordination. And we are seeing gradually also better proposal coming up. Clearly, the result of better understanding on how to implement actions. But we must look ahead, it's part of your question, how we sustain it with a long-term strategy. Based on our experience and our model, which is country-led, disease agnostic, catalytic, collaborative, and flexible, I would emphasize 3 things. The first one is it's essential to engage all stakeholders. You mentioned it, I want to repeat it, including government officials, scientists, CSOs, organizations, business leaders too, in collaborative effort that transcend existing silos and sustain this. This is the whole society approach, and not only in words, but in concrete action. Second, we must clearly demonstrate the added value of One Health, how investing in prevention reduce outbreak costs, how cross-sectoral trainings improve efficiency and lower cost, and how integrated surveillance systems benefit for both human and animal health. And third, we must empower countries to lead, to take ownership, and to put their own skin in the game. If you incentivize them, they'll do it. Yes, the current situation is tough, but it's also an opportunity, I mentioned it before, an opportunity for a country to shift also from dependency to sovereignty. We can see already a sign of its readiness in Africa with several countries, with the Accra Reset, with the Africa CDC work on domestic resource mobilization, and it's also a kind of optimism message. So let me close by saying this. The One Health approach is not just part of the solution, but it's also essential for today's challenges.
Thank you so much. We've got about 4 minutes before I have to close the panel, but I'd like to invite Christian, Wanda or Nina to come back in and interact on anything you've heard. I mean, the case was strongly made by you. We need more collaboration. What are you seeing from your quadripartites? Can we expect more collaboration?
I think collaboration will be key, and those discussions are continuing. But I do think, it was mentioned now a few times that it's not a bad thing to sometimes relook at things. We sometimes are stuck in these documents that we've written. I do think we need to rethink how we must integrate One Health. Because I do think, from my own perspective, the One Health Joint Plan of Action was, for instance, done in 6 tracks, with environment being a separate track, which immediately created a bit of silos. So one of the things we're advising the quadripartite now on is how to really integrate environment into health of animals and health of humans. That's just one example. So I do think we need to think really about how we can optimize what we need to do. We also, I think, putting a lot of pressure on member states from that perspective, by having 4 UN organizations sometimes trying to still do the same things if we get down to regional or country level. And that's really one of the discussions that's also going on between the 4 organizations of how we can optimize that, especially in resource-constrained times. So it's definitely part of the discussion. I think the commitment is there still. And we just need to find a bit of a more effective way of working going forward.
Thank you. Nina?
So, and totally agree, but to highlight an essential focus, if we enable communities to protect themselves and their livelihoods, because they're the ones who come into daily contact with animals, I think this would be the best investment that we can do in prevention. People who rely on animals for their survival are not going to abandon high-risk practices unless they are part of the strategy. So anything we do on One Health has to be rooted in communities. This is how we also achieve equity.
Last word from our virologist.
Well, so we are fighting the prevention paradox, right? All over the place.
Yep.
And what I am afraid of is really that we are missing this reality that it is very difficult to convince policies over the prevention paradox, right? So it is just weak to have prevented something and to not be able to prove something. And as we will have the first sign of the next upcoming pandemic in terms of a group of infected patients, right? We will also have to find an intervention in the One Health area, right? So we have to, let's say the term medical countermeasures is now much more popular in the pandemic prevention and intervention context. But where is the counterpart on the One Health to this, right? I believe we have to walk in steps. And the next step will probably not be to convince everybody in spite of the prevention paradox. The next step will be to come up with a concept that is a counterpart to the medical countermeasures sphere in the human medicine, public health interventions planet on the One Health side. And this is really an unsolved question. I mean, we can say practices, we can say surveillance, we can say vaccination programs, but all of this is still a bit lame. Yeah, we have to find a different identification feature here.
Yeah. Yep, very powerful point, and really bringing, I think, the lens to it from public health. You know, we could invest an enormous amount in trying to find a cure for lung cancer, but if fewer people smoke, there'll be less of it, right? So you know what happens when you don't act at the prevention end. So it's getting that investment in prevention that's the breakthrough needed. Thank you so much to our lovely panel. Thank you. And now we're bringing on a policymaker. We are bringing on Dr. Georg Kippels, Parliamentary State Secretary of the Federal Ministry of Health. Dr. Kippels, please.
Thank you very much for the opportunity to give a short intervention from the political side. Right Honourable Helen Clark, Excellencies, ladies and gentlemen, I would like to thank you on behalf of the German Federal Ministry of Health for joining us today to discuss this very timely global health challenge. As clearly pointed out in the expert panel, momentum is building for governments to improve how humans interact with animals and the environment through the One Health approach to address global health challenges like pandemics. With the adoption of the pandemic agreements, governments have endorsed the One Health approach, which recognizes the interconnectedness of human, animal, and environmental well-being in an international, legally binding instrument for the first time. This is not least due to the tireless work of the FOUR PAWS International. I have the utmost respect for your work. There is a recognition that the way we treat others has an effect. This is not just a philosophical idea. The way we treat animals and nature undoubtedly has an effect on human health. Tackling current health crisis requires an approach which captures the complexity of current health crises and addresses them holistically. The One Health approach. We understand the One Health approach as a concept that stands for an integrated, unifying approach which aims to sustainably balance and optimize the health of people, animals, and ecosystem according to the One Health high-level expert panel. While there is no need to repeat the meaning of the One Health approach to an expert audience like you, there is still a long way to go. The negotiations of the International Pandemic Agreement revealed that the term One Health poses a certain controversy, and the will to tackle health crisis in a holistic way is not self-evident. I am therefore pleased that Björn Kümmel will later report on our experience during the negotiations of the pandemic agreement in Geneva. However, only with the knowledge of the One Health approach we are capable of understanding the complexity of health-related phenomena such as COVID-19, biodiversity loss, the climate crisis, or AMR. Let me give you an example of the interdependence between humans, animals, and the environment that has a significant effect on global health. Biodiversity loss and ecosystem degradation occur at an alarming rate driven by human activities, like urbanization, which is threatening ecosystem services, clean air, water quality, and food systems. All of that with direct consequences for human health. It is, however, not only the human that is directly affected. Animals and plants living off polluted water and wild animals driven out of their natural habitat due to deforestation pose the risk of spreading pathogens more easily from animals, plants, and food to humans. Nonetheless, there is something we can do to achieve better health for all. I'm particularly hopeful when I see improvements and innovation in monitoring and surveillance systems for better health. One example is the establishment of better wastewater monitoring. Wastewater is a valuable source in gathering information on pathogens. Targeted wastewater monitoring offers the opportunity to detect waves of infection at an early stage, for example, as a predictor of increasing SARS-CoV-2 infections within a population. Collaborative monitoring and surveillance efforts help us to break down the traditional silos between health sectors to better inform public health decision-making, improve the early detection of outbreaks, and implement effective preventive measures across human, animal, and environmental health. Only when we understand this interdependency, we can make a sustainable and positive impact for a real change towards better global health. As mentioned in the beginning, including One Health as a part of the pandemic agreement presents a paradigm shift. The two key implications of this paradigm shifts are, first, better prevention must be the goal. Protection human health should no longer only be focused on symptom control. Second, a better multisectoral collaborative approach is needed. To prevent future pandemics and efficiently face global health threats, we need more holistic and effective strategies. In the past, we have already taken important steps. The One Health approach has already been adopted by UN member states in high-level international and regional institutions, agreements and documents. But the pandemic agreement is the first international and legally binding instrument rooted in the One Health approach. This is a powerful multilateral achievement to effectively and jointly prevent, prepare for, and respond to pandemics. This is a milestone and a ray of hope. However, we should not stop there. There is still a lot of challenges such as administrative costs, interoperability, data protection, and creating a suitable legal framework. Ladies and gentlemen, the One Health approach reminds us true health protection starts before symptoms appear, with smarter prevention and stronger collaboration. The One Health approach is more than a concept. It's a commitment to act smarter, earlier, and collectively. Let's turn that commitment into action. I would like to thank you for your attention and hand over to the Right Honourable Ms. Helen Clark. Thank you very much.
Well, thank you very much, Dr. Kippels, and for that strong statement from the Government of Germany on the One Health approach. And we'll keep hearing these words, the importance of prevention, collaboration, more holistic approaches. Let's bring in then our next panel. We have WHO, we have Brazilian Ministry of Health, we have the French government, and we have the German government. Please, panelists, come and take your seats. So, as I said, we've been hearing a lot about holistic approaches, multi-sectoral approaches, and everyone here has insights to bring on how we take this forward. So, Dr. Stella, you are Director of WHO Health Security Preparedness and the Health Emergencies Program under our friend Dr. Chikwe. You have a central role as the paramount global health agency, but obviously all of this is about collaboration across agencies. So how's WHO approaching this today to amplify this level of collaboration across agencies and sectors?
Thank you for having me. Every major health emergency has pointed to the fact that health is not just the business of the Ministry of Health. It is about societies, it is about economies, it is about livelihoods, education, as well as progress and national prosperity. Multilateral collaboration is no longer optional. It is an imperative if we must effectively prevent, prepare for, and manage health emergencies. Global, regional, and national governance mechanisms embed this principle now. The recent amendments to the international health regulations, the legal backbone of preparedness and response, entered into force on the 19th of September for most states parties. And it does include provisions around facilitating multi-sectoral implementation through the establishment of dedicated national authorities. The translation of this means coordination across sectors, as well as a whole of societal approach. The pandemic agreement, which every speaker before me has talked about in this forum, specifically asks countries to take measures that are aimed at promoting human and animal and environmental health, to implement national strategies and policies that reflect One Health approach and that is coherent, collaborative, coordinated across the relevant sectors and actors. These are our legal anchors at the highest levels of global governance. But how do we operationalize this? One Health provides a practical method for organizing decisions across human, animal, and environmental health so that we act earlier, so that we are more coherent, and so that we have shared accountability. In 2023, the quadripartite made up of FAO, UNEP, WHO, and WOHA issued a joint call to action urging countries to put One Health at the top of the political agenda and to move from concept to implementation. But on the practical side, the decisive test is how we embed this across every pillar of preparedness and response, in our risk assessments, in our surveillance, in our workforce, and how we institutionalize One Health in national and subnational systems. So, what is WHO doing concretely about this? With the quadripartite, WHO is deploying practical One Health tools, including workforce planning approaches, so countries can map functions, can train for One Health competencies, and close real-world gaps. I'll give you a few examples of what we're doing concretely with our partners, with other UN organizations, and with our member states. A risk assessment tool that allows ministries to routinely assess threats together, to agree on who leads on which hazards, and the trigger pre-health actions that should be taken has been developed. To date, 68 joint risk assessments have been conducted across 65 countries. Turning assessments into clear roadmaps has improved collaboration. Through the IHR PVS National Bridging Workshops, public health and veterinary services co-design practical roadmaps, now reflected in many national action plans for health security. So the gaps identified together are financed and closed together. To date, we have conducted 67 bridging workshops. Undertaking collaborative surveillance, as was mentioned before, end-to-end has been another strategy. We support countries to link human, animal, and environmental data to set rules for data sharing and protection, and to strengthen laboratory and genomic capacity building. WHO's surveillance and information sharing operational tool supports authorities to establish or strengthen coordination and connection between surveillance and timely routine data sharing between sectors. To date, 14 workshops have been undertaken. Another example is the developing the workforce to deliver on One Health approaches. And here, with the workforce development tool, countries map essential One Health functions. They define competencies across public health, veterinary, and environmental sciences. And they design cross-training and surge rosters so that the right people with the right skills are at the right place and right positions. We are now accelerating implementation. This is much more recent in the last year or so, and we have 7 countries that have undertaken these workshops. We have also the experience of having One Health catalysts in countries, and these have driven, and these are national people, so they know the countries, they know the issues, and they have driven and maintained attention on One Health, and this has proven to be a real game changer in countries. I cannot stop without coming back to something that has been raised over and over before, And this is ensuring that the communities are at the center. Community health workers, when integrated in strong primary healthcare networks, form the first line of detection and response. They translate risks, information into action, links community to formal surveillance and care, and reinforce the trust through everyday engagement. That is how prevention at source actually works in villages, in farms that we talked about, in marketplaces, and in border communities. When health, agriculture, environment, and finance share a table, a budget, and a common set of priorities, prevention at source moves from paper to action.
Thank you, Dr. Stella. So, Dr. Ethel Maciel from the Brazilian Ministry of Health, bringing it down to the national level, tell us how you're making it work collaboratively across sectors.
This probably will take like month to explain all the problem, but it's a very new experience in Brazil since we have the new president in 2023. We start working with this, and Brazil maybe has like quite a unique experience because we building for 35 years our universal health system, which we are very proud of this, all with domestic fund. So it's a biggest budget from the government, different for the other countries. The Minister of Health has the budget to do all the things. And when I was trying to bring this subject for the table, because I need to convince the presidential cabinet to make some decree, because I cannot go to the Minister of Agriculture and Animal Resource and Environment, say, I need your data, we need to integrate. We have like a high-level decision. And you cannot imagine how many meetings, and even the word, it's a complication. Because when you are a colonized country, and it is very important to say that, you are very suspicious with new policy that came from outside, and this can be a mess in your system. So only to translate the word took us like 9 months. Only to have an idea. And the first meeting with the cabinet, the president cabinet, he said, "You are not convincing me. No, it's can go. We have a lot of problem. Don't bring me another problem that we don't have yet." And I'm saying, I'm just a messenger. The problem is there. We need only to build the solution. And after 9 months, we have a presidential decree, and I was appointed for coordinating all this committee, interinstitutional, because it's not only interministerial, because there's some Federal Council of physicians, nurses, vets, and pharmacists, and some institution of research, so a lot of institution. I thought that maybe this is, no one wants to participate in this, it's a new thing, but surprisingly, we have a lot of people from this minister and institution that want to participate. And this took more 1 year to build a national plan. And this national plan, as we are trying to, after dictatorship, be very democratic, we put this as a national consultation, public consultation. So people can vote, can say, I agree with this, I don't agree with that. And finally, in August, we finalize this, and probably this will be launched by the president in we are trying to be in the COP30, but we don't know if it will be possible because there are some issues after the consultation that we need to change. And but I think until December this will be there. I'm out of the Ministry of Health right now, but the team was still there, and I think after December we'll have something to go. I only want to finish to point out three things. Helen, in the beginning, Dr. Helen said that we all agree about prevention in this room. Outside this room, it's not that way. Especially for politicians, because prevention don't give votes. What give votes? It's building clinics, building hospitals. So prevention don't give votes. It's very complicated, and the politicians make our budget in all the country. They vote for our budget, so this is a problem. The second challenge that I think is the integrated data, because when we start to work together, we saw that our mindset are different. As in human, the early detection, we communicate very rapid because we know that this what we need to do. It's not the same in agriculture. It's not the same in animal, because it's mean economy. They are very cautious about this. They only do this in the end of the process when they are very sure about this. So the mindset is completely different. Integrate is very complicated. And the other thing, it's about budget, our resource, and even the research. We don't want to work together. We want to do the same thing in the same way with new money. So it's very complicated. When you put that together, the virologist wants to be the virology, the physician wants to be the clinical trial, but they are not doing together. So even the call for the budget needs to be changed, and we need to transform what we are doing right now. So thank you very much.
So the reality from Brazil of trying to move these issues forward. Thank you so much. Ambassador Anne-Claire Impro of France, give us a French perspective on how the One Health approach is progressing.
Yes, good morning everyone. I'm not here as a former co-chair of the negotiation of the pandemic agreement, but asking member states at 5 o'clock in the morning to green the articles 4 and 5 of the pandemic agreement dealing with prevention and what else. It was about that 3 or 4 or 5 o'clock in the morning. I don't remember, actually. Yes, I'm here to talk as French ambassador and to talk about France. Actually, in France, it has been a priority as we have tried to favor prevention in health issues. And I'm saying try because, as it was explained earlier, it's always a challenge to focus on prevention instead of cure. And I would say, after many years, and especially after being Deputy Director General for Health, we implemented the One Health approach without calling it One Health and without knowing that it was about One Health. I would give you an example. At the beginning of 2000, we launched a multi-sectorial approach with the Ministry of Health, Agriculture, Environment, and we launched what we call the National Plan for Environmental Health. But it includes, in fact, the interface between the human, animal, and environment health. And now it is a 4th plan, which covers the period until, I don't remember the date actually, but 2025, that's the last one, but that's the 4th plan. So we did it without calling One Health and before the COVID-19 pandemic. Of course, the COVID-19 pandemic has further emphasized the importance given to the One Health approach. That's why when we work on the global health strategy, because it's a combination of national and international interventions, we decided to have a guiding principle, which is One Health. And it was very, very important. And in this context, in line with the priorities and guidelines of the quadripartite, we support many initiatives, among which the development of programs dedicated to raising awareness and providing continuing education for decision makers, but also training, especially with the WHO Academy. So it's a combination of national and international interventions. And we talked earlier about research, and France was a founder member of the PREZODE initiatives. So it's good to talk about political priorities, but what about the budget, as you mentioned? It's another matter. So internally in France, I will not comment it, as there are some debates in France about the budget.
Yes.
But at the international level, at least, we try to support financially the One Health approach. The PREZODE initiative, for example, because we thought that it was very important to invest in research, but also in implementing the One Health approach when we talk about PPR, and especially after the panel and the recommendations. So that's why France decided to join the Pandemic Fund, and we are very happy to contribute and to be a board member. And we are very happy to see that the first large-scale regional projects adopting the One Health approach are beginning to bear fruits, and I think it's good. The third aspect is the normative legitimation through the pandemic agreement, but also the national law. That's another question. And of course, we have the pandemic agreement with the One Health approach in the article for the very first time. That's good. And I would like to take this opportunity again to thank member states, but also civil society, such as FOUR PAWS, for their commitment and their work in the corridors in Geneva at WHO. That was very, very helpful. And that's why I would like to echo what you said. It's not only a matter of government, it's a matter of civil society, citizens. So now we have a wonderful pandemic agreement. We are waiting for the annex. But it's now up to us to translate our commitments into long-term concrete action at the international level. And in 2026, we will have the high-level meeting on PPR, but also at the national level with our citizens, our politicians, to make some decisions about the budget. So we need to build on what we have done, the pandemic agreement, for example, and to keep the political momentum and to explain our citizens what it means concretely. So that's why the French government decided, and the French president, to continue carrying this message. And France will host a presidential One Health Summit in 2026. I will not give you the date, because I'm not allowed to do that. Very soon you will know. And it will be co-organized with partner countries and, of course, the quadripartite organizations. The idea is to bring together public decision makers, scientific researchers, international organizations, donors, to catalyze actions and to illustrate the concrete impact of the One Health approach. And especially, and that will be my last word, as I said at the very beginning of my intervention, we implemented the One Health approach without knowing that we were talking about One Health approach. And when we look at countries, that's very often the case. So just to demystify the One Health approach, I think it's very useful. and to take some examples of very concrete actions we can see at the country level. I'll stop here.
Thank you very much. Well, last but not least, Björn Kummel, who's head of Global Health Unit in Germany's Ministry of Health. Germany was a very vocal advocate of the One Health approach and the pandemic agreement. Where's Germany, Björn, in its own One Health journey? What are you doing well, and what challenges have you got to overcome?
Thank you, Helen. First of all, it's a great honor to be here with you. So if you had wanted to have someone talking about the German approach, then I would be the wrong one. So FOUR PAWS knows that. And so I'm the expert for international negotiations. So I'm going to talk about the pandemic treaty or pandemic agreement and how the One Health approach has made it in, to be honest. So we applaud ourselves, and it's a huge success, nothing against that. But the reality is almost nothing was more controversial than the One Health approach. Does it exist? We had irritating debates in the negotiations. From my point of view, with regards to One Health and prevention, the pandemic agreement, you can say it's the glass is half empty and half full at the same time. Half empty, if you're looking at the 4 spillover effects, are they adequately addressed? Deforestation, mass production of animals, wildlife markets, and laboratory safety. To some extent, yes, to some extent, no. I mean, my personal hope had been that after this once-in-a-century crisis, or maybe not once-in-a-century crisis, that touched or was imposing or changed the lives of all of us, all together in this room and outside this room, we would be ready to make more substantial changes with regards to One Health. And it was irritating that we were not even more successful. I think we were successful because it's codified. It's obviously we have Article 4 and Article 5, but it was an uphill battle. Why? Yeah. I think it was much easier to have this huge divide between the North and the South with regards to countermeasures. It's easier. I think the divide would have been more difficult, and it would certainly not have been Global South versus Global North with regards to deforestation, mass production, AMR, laboratory safety, and wildlife markets. Yeah, it's more difficult. You have emerging economies who are completely against One Health approach on that side, and potentially some industrialized countries in favor. There were not too many moments that made my European heart beat with lots of proudness. Obviously, Unclear managed, and there was really something that I think we need to applaud. The unthinkable, at some stage, I thought it's impossible to get this deal done, and due to our European representative the co-chair, I think we made it at the very end. And it was some moments I thought we are not very close. So there was the one moment. The other moment was, often enough, we don't have European unity, but there was one moment where we had it, and that was on Article 4 and Article 5. We had lengthy debates with 194 member states in the negotiations whether there should One Health and the concept and prevention should at all be included in the pandemic agreement, and whether there should only be a focus primarily on the response side. And then the EU came up with a very, very strong voice and said, we will leave the table. We will not negotiate further unless we have either an annex or substantive provisions in Article 4 and 5, which we in the end got, which I think is great. I think they could have been even better, but we need to work on them. I think there are a couple of lessons learned here. I think we need to push further. It's not that we all love the One Health approach in this room. I think there's a strong role of civil society to push further, push on all sides. I can give you the list of countries later where you have to push a little bit more, and let's remain ambitious. Yeah, as Unclear said, and my parliamentarian state secretary, there were lots of moments in the negotiations where at least I lost trust that we would make it, also with One Health. I don't know who knows WHO and the room where we negotiate, but you have to more or less walk up the stairs, and then you see the light again after I don't know how many hours. And whenever I walked up the stairs, I ran into the hands of FOUR PAWS, Nina and Nelson. Yeah, who basically cheered the German delegation up and said, no, 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 keep on pressing, keep up more or less the ambition. Yeah, we can do better. We can do 2 healths, obviously, not only 1 health. There was a running gag in between us. But honestly, I think you played such a decisive role for 1 health overall, but also as a bridge builder, because too often the Global South saw 1 Health and prevention as a bargaining tool vis-a-vis getting something from the Global North on the response side, which is completely inappropriate from my point of view. And you clarified with many of the actors on the Global South that they are outstanding performers with regards to 1 Health. Yeah? And unless you had performed this bridge building, I think we wouldn't be where we are. Thank you so much.
But Bjorn, just to decode that further, the opposition to these Articles 4 and 5 on 1 Health, was it because it was in the trade-offs on other issues, or was there opposition in principle to having a 1 Health approach?
I think both. I think some really had the idea that this is only on the response side, that there should be certainly no obligation. And there was also a misconception that it's imposing primarily obligations on the Global South, which certainly is not the case. Yeah? Much what we see about the pandemic agreement in the negotiation, but also outside, is conspiracy, fake news. And also there, I think, civil society can play a decisive role in bringing in evidence-based information. I mean, you see that outside the room. If you cross the street, you see disturbing colleagues with interesting posters, but you can, well, we also had that obviously in Geneva, yes.
We've got about 10 minutes where we can take some audience interaction, and it's a room full of people who are keen and interested, so please, yes, I think we have a mic coming. And please introduce yourself.
Thank you very much. My name is Akua Senadanswa from Ghana. I belong to the United Parliamentarians Network for Global Health, chapter chair for West and Central Africa. So far in this room, I haven't heard anybody mentioning the role of parliamentarians. And you all agree with me that in whatever we do at the global level, at the national level, it takes the active participation and commitment of our members of parliament to get things going. So if we are considering stakeholders, major stakeholders, I think we should include parliamentarians. Then at the decentralized level, you know, pandemics or epidemics break out in the localities, because in the big towns, good health is practiced, animals are vaccinated, but the animals in the wild, in the districts, in the local areas, they start the problem for us. And so if we are talking about stakeholders, I think we should also include local government administrations, because these problems start from there, and we ultimately will need the resources to do the prevention, the management, and whatever. So please, I'm here to advocate for local governance and local government administrators. We are a very major stakeholder in this whole process. Thank you very much.
Well, as someone who was a parliamentarian for 27.5 years, I completely agree with you. And you made a speech Martin Chungong would have made if he was here. So thank you for that. Very important. And also the role of local government. And, you know, I mean, national systems differ, but in many places, local government would have a lot of competency over these kinds of issues. So I think working through their associations, whether it's Commonwealth Parliamentary Association or the global local government organisations on this approach is very, very important too. So thank you for making those points. Right, who else has a hand up? Please, yes.
Thank you very much. My name is Baljit Singh. I'm Vice President Research at University of Saskatchewan in Canada. I want to make a comment. I don't have a question. I've been part of a couple of international training programs in One Health, including Germany, India, Brazil, and we have worked together with hundreds of students over many years. What I still believe is that the universities are the slowest movers when it comes to One Health. Many students are passionate about that, but the curricular change which is needed in the universities is not happening. In Canada, we don't have any universities still where students from medical sciences, nursing, veterinary medicine, environmental sciences, public policy work together in a structured way to look at case studies and find ways how to collaborate and to understand at a deeper level through pedagogic system that how do you collaborate with each other. What we are trying to do is move very large pieces at the government level and have departments collaborate, which are comprised of people who were trained in silos. So we are trying to change behaviors of grown-ups. So how do we change the autonomous educational institutions to inspire curricular change so that the young people in this room can get those opportunities to work together? I will close by saying some of the graduates from the training program that we did from 2012 to 19, those graduates in India, Brazil, Germany, South Africa, they did commendable work during pandemic because they had found a way to work together. So really, thank you very much. I'm very inspired by the French example of working together. So thank you.
Thank you so much. And one last one over here, please.
Thank you. Thinking short-term and practical, this question goes first for Brazil, but it's also for Germany and France. So next milestone, COP30, where's the One Health approach or opportunity there, and how other countries, France, Germany, and many more, can make like concrete steps?
Right, let's come back to the panelists. I think, Dr. Ethel, you said you're not quite sure whether One Health will get an airing at the COP.
Yes. Right now, we are in a very, how do you say, difficult situation, because as with this geopolitical change in the world, in this week, we have a pre-COP meeting, because as the negotiations are not going very well, the COP presidency decided to a new, it's not in the beginning, but it's a new meeting in this week in Brasilia. So let's see what will happen. We are talking with France, because right now Brazil and France celebrate 200 years of friendship, and we are working together in a lot of COP30 events, and AMR are already there, and by AMR we are talking about One Health, and we are talking about arbovirosis. This is what we are already doing. And there is a ministerial in November 13, with the day of the ministerial meeting, the health ministerial meeting. And we're not able to finish the plan to launch there, which was in my mind in the beginning, but was not enough time. And this is pretty much what we have right now. So I don't know if other country, because German and all the countries that have a stand in the blue zone on everything was happen, they can do this. I don't know for the other countries if they have a specific event in this subject. Thank you.
Thank you. We've got 5 minutes left. So Anne-Claire.
Yeah, thank you. Just one word about the COP. I will not comment the next COP, but if we look at the progress we made with the COPs, now we have a day for health and climate. It's a huge step. I mean, many years ago, I'm not sure that we expected that. So it's not enough, definitely. We need to continue, but we need also to recognize the step we have made and the progress made, and including, and that was my last word, if I would say, including everybody. And I couldn't agree more about the parliaments. That's why I said we need decision makers, parliaments, civil society, but our citizens as well. that's very important. Otherwise, we cannot make progress and we cannot explain and have a concrete implementation. That's also one concrete objective of the Presidential World Health Summit that we will have in 2026. And of course, you will be all welcome to join.
Thank you. Björn, and then I'll end this.
So I'm not the expert for the COP, but as a country, you have sometimes at least the possibility to set the agenda.
Yeah.
If you are G7 or G20 and you rotate to be the presidency. Next year, I think at least one of our countries has the possibility to set a strong focus on health, and potentially One Health could be. The other one, I think, is the US. So maybe in the other forum we hear less, I assume, but that gives even more possibility and credit to France. So we're looking forward to that, unclear.
Thank you, Björn. Quick word from Stella.
Yeah, no, just to say that I think that we are at a point where we have a great opportunity to move forward this agenda. We've got a mandate, we've got tools, we've got the will, and we've got the stakeholders around that are ready to make this move, including the parliamentarians, who not only pass the legislation and policies that we're talking about, but also interact with their communities and can take a lot of these issues from their communities back to the governance level. So let us move this agenda forward. Let us align our resources. Let us align our priorities, and the next time we meet around the table, we hope that we'll be talking about more concrete examples of how implementation has moved forward in this arena. Thank you.
Very good. Thank you. So, just to remind this engaged audience, there's another session today on From Policy to One Health in Practice, which is taking place at 2 o'clock. So the conversation can be continued. As well, we are in the sort of year's run-up to the next high-level meeting on pandemic prevention, preparedness and response at the United Nations, September next year. One Health needs to get into the declaration. The high-level panel has produced a report on what we think could usefully be done to prepare for that meeting. Christine McNabb, who will wave to you now, probably has copies of the report for those who are interested, and we certainly look forward to engaging with people to make that high-level meeting a success. Thank you, everyone, for coming.